The retrosigmoid approach. The retrosigmoid craniotomy is the workhorse craniotomy for access to lesions in the posterior fossa and can be used to remove lesions in the midbrain, pons, as well as in the medulla. For lesions located laterally, the retrosigmoid craniotomy is performed at the transverse sigmoid junction. Opening the craniotomy in this location allows the surgeon to access the cerebellopontine angle fissure and release cerebrospinal fluid, which in turn allows access and visualization of the lateral brainstem. The cerebellum is gently retracted as spinal fluid is released. Upon opening of the arachnoid overlying the cranial nerves 5 through 12 may be visible through this approach. For entry to lesions within the pons, 3 well-accepted safe entry zones have been described. These include the supratrigeminal, peritrigeminal, and middle cerebellar peduncle safe entry zones. The sequential axial sections demonstrate the path of the incision placed for the supratrigeminal, peritrigeminal, and middle cerebellar peduncle safe entry zones. This lateral view of the brainstem depicts the placement of the 3 safe entry zones for gaining entry into the pons relative to the 5th nerve. The supratrigeminal safe entry zone is placed immediately above the root entry zone of the 5th nerve, while the peritrigeminal safe entry zone is located between the takeoff of the 5th and 7th 8th nerve complex. A workhorse used at the Barrow Neurologic Institute is the middle cerebellar peduncle safe entry zone. The orientation of the incision for this safe entry zone is in line with the direction of the fibers traveling through the middle cerebellar peduncle. This safe entry zone can be readily used to access deep pontine lesions with minimum morbidity to the patient. In addition to gaining access to pontine lesions, the retrosigmoid craniotomy, when placed lower, can be used to access medullary lesions. In the medulla, several safe entry zones have been described, which can be accessed using this approach. These include the lateral medullary zone, the olivary zone, and the anterolateral sulcus safe entry zone. This depicts the placement for small openings into the brainstem used for the lateral medullary zone, olivary zone, and anterolateral sulcus safe entry zones. Tailoring the retrosigmoid craniotomy to the specific region of the brainstem to be accessed allows us to take advantage of a robust series of safe entry zones, which can be used to address a wide variety of pathologies. The retrosigmoid approach is a workhorse in part because it is so well tolerated by patients.